The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease.
So I think there are a number of things that people can do to try to make sure their immune system is in good shape if they happen to become infected with coronavirus. I'm Philip Calder, I'm Professor of Nutritional Immunology at the University of Southampton.
Boosting your immune system has never felt so important. While it can't stop you getting coronavirus, it can help your body fight it. So I'm speaking with Professor Calder to find out how your immune system does this and what you can do to support its vital role. Philip, how does the body or the immune system help us beat a virus?
So the strength of somebody's immune system won't influence whether they actually get coronavirus. That's why hand washing, social distancing, those are the things that will stop people actually getting the virus. What the immune system does is it helps people deal with the virus once they've actually got it. There are all sorts of cells that are part of the immune system that each have their own jobs to do. 2 of the most important cells are called natural killer cells, and a type of T lymphocyte which is called a cytotoxic T lymphocyte. Both have the ability to destroy cells which are harboring viruses.
Now, is it correct to say that you can boost your immune system?
Some people use the term boosting the immune system. I prefer to use a different term, which is supporting the immune system. And there are lots of reasons why people's immune systems are different from one another. So some of it is to do with age. Some of it has to do with disease. Some pharmaceutical drugs or treatments, like treatment for cancer, they weaken the immune system. But there are other things that also influence how well our immune system works. Because we understand some of the reasons for that, that means by manipulating those things that influence immune function, like getting people physically fit, like improving their diet, like not smoking, not having too much alcohol, not being in polluted environments, we can actually improve their immune response. And that's what I mean by supporting the immune system to work better. Because what we want is an immune system that functions properly when it's challenged with bacteria and with viruses.
Can we get into some of these foods that you can eat and how they help the function of your immune system?
The first would be a variety of fruits and vegetables, and that's because fruits and vegetables are very good sources of many vitamins, of many minerals that are very important for supporting the immune system, and also of polyphenolic compounds. So these are the compounds that give the color to many fruits and to berries and so on. Second, I would say good sources of fiber and plenty of fiber, because some of the fiber which we don't digest is actually used by the bacteria that live in our intestine and promotes the growth of good bacteria. And those bacteria have an interaction with our immune system to make it work better. Thirdly, I would say oily fish as the really important source of omega-3 fatty acids. And omega-3 fatty acids are really important in sort of regulating role and controlling the immune system from getting out of hand. Then the other thing not to forget is meat is a good source of some important nutrients like iron and vitamin B12. So it's very important for people who choose not to eat meat for various reasons that they make sure that they have good sources of iron and vitamin B12 and maybe a few other nutrients. And that may be a situation where people need to consider supplements, for example, particularly of vitamin B12.
Now, what about probiotics? How do these support the immune system and how is their role different to fiber?
Probiotic bacteria can have a role in helping our immune system. Probiotics are live bacteria, so we're really seeding our gut through consuming probiotics. An alternative is a diet with a variety of plant-based foods, including plenty of fiber, and that is really providing the environment that allows those sorts of bacteria to grow in our large intestine particularly. So we've got a choice really between seeding our gut with probiotic bacteria or sort of helping bacteria that are already there along by consuming fiber and other plant foods.
Now, is there any way to know which probiotics have a greater benefit or even any benefit at all?
There isn't really. Most of the commercially available probiotics do colonize the gut, and showing that they colonize is one thing. But showing they have an impact on a person's health is a little bit trickier. And it's probably true that not all commercially available probiotic organisms actually have a health benefit, but it's very hard to tease that out, and it's very hard for the consumer to know that.
Is there anything else we can do, including anything kind of less mainstream?
There are a lot of things that can be done that might have small impacts on the immune system. Whether they actually make a big difference as far as dealing with bacterial viruses is concerned probably isn't really known. One thing to keep in mind is that any form of stress influences your immune system and sort of weakens it. So things like, meditation, yoga, physical activity are probably quite useful. And there are papers on very unusual things like music, for example. That sounds a bit strange, but if you imagine all of these things, meditation, yoga, listening to music, you will have release of chemicals, mainly from the brain, which are about having a peaceful sort of environment. And probably some of those chemicals impact on the immune system and help it to work a little bit better. The other one is getting good sleep, and enough sleep is very important for the immune system. And what happens is while we're asleep, our immune system actually is sort of renewing itself, and new cells are being produced that are released back out into our bloodstream after we wake up. So I think sleep is also very important in terms of helping our immune system be in good shape.
Hello everybody, I am one of the unluckiest person in this India जिनको पहले कोरोना वायरस डिटेक्ट हुआ था. अब मैं बिल्कुल ठीक हूँ, 14 दिन का आइसोलेशन था, ट्रीटमेंट था, एंड आई एम बैक एट होम बिल्कुल ठीक, कोई प्रॉब्लम नहीं है, कोई दिक्कत नहीं. ये वीडियो बनाने का मकसद ये नहीं है कि मैं आपको कोई टोटका बताऊंगा या इलाज बताऊंगा कैसे इसको ठीक करना है। सिर्फ इसलिए वीडियो बना रहा हूँ कि प्लीज़ 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 डोंट पैनिक। अगर आपको कोई सिम्टम है डॉक्टर के पास जाएं, या फिर जहाँ भी आपके शहर में कोरोना वायरस के टेस्ट हो रहे हैं वहाँ पे जाएं। और अगर पॉजिटिव आता है, भगवान न करे ना आए, अगर पॉजिटिव आता है तो डॉक्टर्स एंड एडमिनिस्ट्रेशन को सपोर्ट करें, जैसे वो कहते हैं वैसे करें। जिन्होंने ठीक करना है उनसे भाग के आप कहाँ जाएंगे। आज इलाज फ्री में हो रहा है, हो सकता है ज़्यादा फैल जाए तो कुछ टाइम बाद आपको प्राइवेट हॉस्पिटल्स में जाके अपने पैसों से इलाज कराना पड़े। सो प्लीज़ गवर्नमेंट को सपोर्ट करें, एडमिनिस्ट्रेशन को सपोर्ट करें, डॉक्टर्स को सपोर्ट करें, जैसा वो कहते हैं वैसा करें। अपने हाइजीन का ध्यान रखें, अच्छे से हाथ धोएं, कफ या स्नीज़ हाथ रख के करें, कम से कम लोगों से मिलें, सोशल गैदरिंग में कम से कम जाएं। थोड़े से टाइम की बात है, वैक्सीन आ जाएगा इसका तो एवरीथिंग विल बी फाइन। अभी लोग बस इसलिए डरे हुए हैं कि एक नई चीज़ है और वैक्सीन नहीं है, मगर इतनी बड़ी कोई चीज़ नहीं है। ये एक छोटा सा वायरस है, आपके सामने हूँ मैं, बिल्कुल ठीक खड़ा हूँ। सिर्फ उन लोगों को प्रॉब्लम है जिनकी बॉडी में पहले से कोई प्रॉब्लम है, किसी को किडनी की प्रॉब्लम है, किसी को लंग्स की प्रॉब्लम है। सिर्फ ये वायरस उन लोगों के लिए ख़तरनाक है, बाकी नॉर्मल इंसान के लिए कहीं से कोई भी दिक्कत नहीं है। सिर्फ 14 दिन के आइसोलेशन में इसलिए रखते हैं ताकि आप किसी और कोई बीमारी ना दे पाएँ। तो प्लीज़ गाइज, सपोर्ट गवर्नमेंट, सपोर्ट दिस सिस्टम। हमें बाकी कंट्रीज से सीखना है, दूसरा यूरोप नहीं बनना है। जब डेवलप्ड कंट्रीज़ अपने देश को नहीं बचा पाई तो अगर इंडिया में फैल गया तो हम लोग कैसे बचा पाएंगे। सो प्लीज़ गाइज, सपोर्ट डॉक्टर, सपोर्ट एडमिनिस्ट्रेशन, पैनिक नहीं क्रिएट करें। कोई भी दिक्कत होती है तो उसके लिए आप अपने डॉक्टर्स पे जाएं और उसका प्रॉपर ट्रीटमेंट लें और अपना टेस्ट कराएं।